And so you touched on your interest in stories as a way to guide public health and health equity issues with how you think about using stories to really connect with people. Because I think that's something that is really valuable in empathetic healthcare and public health in any kind of care that sometimes in our technology driven world we forget.
Phicil-itate Change is my startup, which is offering both advisory and AI solutions for healthcare innovators, really with the intention of putting patients in the center, really being very radically patient centered. And the first product that I'm working on building is Compass Project. And Compass Project is intended to be a platform that is utilizing blockchain and AI to really help health tech entrepreneurs and innovators to accelerate their time to product market fit through directly engaging with patient stories and their data. And this platform will be able to generate very unique and deep insights. So those are the kinds of things that we want to bring into that innovation space. And we need to have a different approach for social innovation that is people-centered. Like now we're walking around with pretty much a computer in our pocket, right? But when it comes to our healthcare, that is a very deep and personal experience. And someone who's lived with diabetes, for example, for 15 years, they're the expert in how to manage and treat their diabetes. And we have to tap into that knowledge by honoring and centering innovation around patient stories.
Let's dig into that a little bit more. Say there's a new startup in Cambridge, two founders at a coffee shop trying to figure out a way to bring a new innovation to diabetes. You introduced me to this new term, at least new to me, social listening, combining that with product development. How does that work? Like, what does it actually mean to the founders? How do you engage with them? What is social listening for the audience? And then how does that really help the founders make faster progress?
So social listening, or you might even think of it as patient engagement, is essentially talking to people about their experience, right? And learning from them what works and what doesn't. And today, what that looks like might be surveys or focus groups, right? To collect people's lived experiences. So with your example of the two founders in the coffee shop, they might put out a survey on their website or talk to people in their network who have diabetes and say, hey, I'm building this app, for example. These are the features it's going to have, and this is what it's intended to do. Would you use it in yes or no type of thing?
Is it, sorry to interrupt, is it similar to customer discovery where we would talk in startup lane, you talk about customer discovery, like trying to learn about your customer? Is that a similar concept?
It is a very similar concept to customer discovery, and it builds on it in the sense that with the current model, it's very limited sampling in terms of the number of people that you're able to survey. And also, like, when you're collecting static data, you're losing the context without the story. We really want to deeply understand the context and the story of people's experience so that we can really tailor the interventions around their experience. They are the center of the innovation.